cat is not eating. And this is not something you can just wait and see. Because when a cat stops eating, something is already wrong. Stay with me, because in this video, I'm going to explain exactly why cats stop eating. Not just the obvious reasons, but the real reasons I see every single week in practice. I'm going to break this down into what's mild, what's serious, and what can become life-threatening very quickly. And towards the end, I'm going to show you one specific situation where waiting even 24 hours can turn a manageable problem into medical emergency. Because I promise you, this one is the most misunderstood warning signs in cats. Let's start with the biggest mistake I see over and over again. Let's just give a day or two. It sounds reasonable. It feels calm, it feels controlled. But in cats, this is often where things start going wrong. Because unlike dogs, cats don't commonly skip meals for no reason. If a cat doesn't eat, there's always a cause. Let me give you a real scenario. Owner brings a cat in and says he hasn't eaten properly for 3 days. And when I ask, when did you first notice something was off? The answer is often, well, probably 4 or 5 days ago. Nearly a week of something not being right, a week of signals being missed. And by that point, we are no longer dealing with a simple issue. In a moment, I'm going to explain what actually happens inside your cat's body when they stop eating, and why even a shorter delay can make things much worse. This is the part most people don't know. Cats are metabolically very different. When they don't eat, their body switches into survival mode very quickly. Fat stores start breaking down. That sounds normal, right? Well, humans do that, dogs do that, but cats process fat differently. Fat gets sent to the liver, and if too much accumulates, the liver becomes overwhelmed. This leads to hepatic lipidosis. This is not a minor issue. This is a condition that can stop the liver functioning properly, causes severe illness, require intensive treatment. And here's what makes it dangerous. It doesn't take a few weeks. It can start within just a few days, especially in certain cats. And later, I'll show you exactly which cats are most at risk, because some develop this faster than others. Now, let's go deeper, because not eating is not a problem, it's a signal. And behind that signal, there are several common causes. Pain is the number one reason, and the most common source of pain, dental disease. Things like inflamed gums, infected teeth, tooth resorption. Those are incredibly painful. But here's what makes it tricky. Your cat won't scream, they won't cry, they won't show obvious distress. Instead, you will see the pattern. Approach food, sniff, maybe try to eat, then suddenly stop. Sometimes they turn their head slightly, sometimes they drop food, and sometimes they just walk away. And it happens so quickly, you miss it. In a moment, I will show you exact micro-behavior at the food bowl that tells me instantly a cat is in pain. Second major cause is nausea. This is very common and often linked to kidney disease, liver issues, infections, toxins. But nausea in cats doesn't always look like vomiting. Instead, you may see lip licking, swallowing repeatedly, drooling, sudden disinterest in food. Or even this, they act hungry, but they don't eat. That contradiction is a massive clue. Now we are moving into serious territory. Chronic disease can slowly reduce appetite. Conditions like chronic kidney disease or pancreatitis, those don't always cause dramatic symptoms at first. Instead, you get subtle appetite changes, occasional missed meals, reduced enthusiasm for food. And again, it's gradual, so it gets ignored. And in a moment, I will explain why some cats appear completely normal, even when the disease are already progressing. Now, let's talk about stress. Cats are extremely sensitive creatures. Even changes you consider small can affect them massively. Examples: new pet, visitors, changes in routine, different feeding location. And in some cats, that's enough to stop them eating. Full stop. And in a moment, I'll show you how to tell if this is just stress or something much more serious underneath. Remember, timing is everything. Here's a simple framework. 24 hours is warning, 48 hours is urgent, but 72 hours is emergency. But here's what is important. It is not just about time, it's about progression. Is your cat completely off of food, eating tiny amount, or showing interest but not eating? Each of these tells a different story, and each requires attention. And now I'm going to show you a single most important behavior to watch right at the food bowl. This is where the truth is. Watch your cat eat. Not just whether they eat or not, how they eat. This is what I look in practice. If your cat approaches food confidently, eats immediately, finishes normally, this behavior is normal. But if your cat approaches, sniffs, hesitates, backs away, this is a red flag. Even more concerning, repeated attempts, small bites, then stopping, sitting near food bowl and not eating. This tells me appetite is present, but something is preventing eating. And that something is often pain or nausea. And now we need to talk about cats that deteriorate the fastest in the situation. Some cats are far more vulnerable. High-risk groups include overweight cats, indoor cats, older cats, previously unwell cats. Those cats are at higher risk of hepatic lipidosis, and once that starts, things escalate very quickly. Those cats often require hospital care, feeding support, intensive monitoring. And this is why early action matters so much. So if your cat is not eating, don't panic, but don't ignore this either. So here's practical approach. Observe behavior closely. Check for food bowl hesitation. Offer fresh, appealing food. Ensure access to water and reduce stress if possible. But most importantly, monitor time carefully. If your cat hasn't eaten properly for 24 hours, you should already be thinking about veterinary advice. Not waiting, not hoping, acting. Well, let's go back to the beginning. Your cat is not eating. This is not the problem. This is a message. And the question is, are you going to listen to it early or late? I see both scenarios. Cats that comes in early and recover quickly. And cats that comes in late when things are much more complicated. And the difference between those two outcomes is often just timing. This video is about giving you that time. If this video helped you to understand your cat better, please like and subscribe to DrVet. It genuinely helps me to create more content like this and helps more pet owners protect their animals. And if you want to learn more, you can click on the video link here or there. I'm DrVet, and I'm here to help you to protect your pets. I'll see you next time.